Today, we're going to explore something pretty incredible: the compassionate and really adaptive world of physical therapy in managing amyotrophic lateral sclerosis, or ALS. It's a topic that honestly makes you think about what care and progress really mean. And that brings up a huge question right at the start. When you're dealing with a disease that's progressive, one that currently has no cure, what can therapy really do? What's the goal? The answer, as you'll see, is both profound and incredibly powerful. The answer is therapy completely redefines the meaning of progress. In the world of ALS, therapy isn't about a comeback story or cure. No, it's a masterclass in adaptation, in maintaining dignity, and in squeezing every bit of quality out of every single day. And you can see that difference so clearly right here. Traditional rehab is all about recovery, right? Rebuilding strength, fixing the impairment. But with ALS, the goals are completely different. We're talking about maintenance, adaptation, compensation, and maybe most importantly, comfort. Success isn't measured by how much strength you get back, but by how much function you can keep. So how does this actually work in practice? Well, this whole adaptive approach unfolds right alongside the patient's journey, which we can really break down into three main stages. First, you've got the early stage, where it's all about preserving function. Then the middle stage, which is about adapting to change. And finally, the late stage, where comfort becomes the #1 priority. All right, let's dive into that early stage. The mission here is crystal clear: preserve function and keep the person as independent as possible, for as long as possible. So in this initial phase, a person might be feeling some mild weakness, but they're still up and walking around. Their big worries? Usually it's fatigue and a new, very real fear of falling. So the physical therapist, or PT, jumps right on that. Their focus is all about maintaining the strength and mobility they still have, and just as important, educating them on how to prevent falls. And they've got a whole toolkit to do this. They use specific exercises that maintain strength without causing that deep fatigue that can actually make things worse. Daily stretching is absolutely crucial to keep joints from getting stiff and tight. And things like balance training, maybe using a cane, directly tackle that fall risk. They even work on low-impact cardio to help with overall endurance. And that focus on balance, it's not just a nice to have, it is absolutely critical. Get this: a staggering 60% of people with ALS experience falls. So this isn't some minor problem. It's a huge risk that early physical therapy is working hard to get ahead of. Okay, so as the disease moves forward, the patient enters what we call the middle stage. And here, as the weakness becomes more obvious, the game plan for therapy has to change. It makes this really crucial pivot from preservation over to adaptation. At this point, weakness is probably showing up in several limbs, making simple things like getting from the bed to a chair a real struggle. Pain and muscle stiffness, that's called spasticity, can also start to become a bigger issue. So the PT's focus shifts right along with it. Now it's about prescribing the right gear, teaching safe ways to move, and actively managing those symptoms for comfort. And these adaptations are super practical. So step 1 might be getting the right equipment, like an ankle brace to help with foot drop, or a power wheelchair to keep them moving out in the world. Step 2 is all about training, teaching both the patient and their caregiver how to use things like a slide board to move safely. And step 3 is tackling the symptoms head-on, using different positions and splints to cut down on pain and stiffness. And then we move into the late stage of the disease. At this point, all the goals of therapy really distill down to their most essential purpose: prioritizing comfort and preserving dignity. In this advanced stage, the patient is often confined to a bed with severe paralysis and real challenges with breathing. They're completely dependent on their caregivers. The PT's role transforms here, becoming almost purely about palliative, comfort-focused care. They're working to prevent things like pressure sores, help support breathing, and, this is so important, train caregivers in these comfort techniques. The comfort toolkit for this stage looks a lot different. It includes things like strict positioning schedules to protect the skin, gentle exercises that a caregiver performs to keep joints from locking up, and respiratory techniques to help keep the lungs clear. This is all done in close collaboration with hospice teams, where every single action has one goal: make breathing easier, minimize pain, and maximize comfort. But here's a crucial thing to remember. The physical therapist is never, ever working alone. They are a key player in what is truly a village of support. This team approach is everything. While the PT is handling mobility, They're working side by side with neurologists, occupational therapists who help with daily tasks, speech pathologists, respiratory therapists, the whole crew. And the research is clear. This kind of coordinated care actually improves not just quality of life, but survival too. And that support system, it doesn't stop with the doctors and therapists. It extends to two other absolutely vital areas: empowering the caregivers and making the most of adaptive technology. This is huge. Physical therapists don't just treat the patient, they coach the family. They teach them how to use mechanical lifts without hurting themselves or their loved one. They show them exactly how to do those gentle exercise routines. They make sure they know how to operate all the essential equipment. This training is absolutely fundamental for keeping care at home sustainable. And that equipment, wow, it's so varied. It can be something as simple as a cane in the beginning, all the way up to an advanced power wheelchair. It includes splints to support weak hands or feet, special cushions and beds for positioning, and even making sure a person is positioned just right so they can use a high-tech, eye-tracking communication device. At the end of the day, it all comes down to this powerful idea. The work these therapists do, it really just highlights the incredible power of physical therapy to genuinely transform lives. It's not about miracles, it's about offering practical, real-world solutions and a real sense of hope when facing something so incredibly complex. Which kind of leaves us with a final thought, doesn't it? How can this model of care, a model that totally redefines progress, that focuses on adapting instead of just fighting, and that puts compassion front and center, how can that inspire our approach, not just to other illnesses, but to all the unpredictable challenges we all face in life?